Britain are doing, that won't work here. Because you see Canada, Great Britain, and Scandinavia, they're paying a large portion of their gross national products on the health insurance plan. Americans are not going to spend that percentage of their money on the health plan. I can tell you that now.
That's where I beg to differ with you, Dr. Robinson, and in my lifetime, being part of this younger generation, is demanding that our money, instead of being sent to Iraq, instead of being sent everywhere else, be sent for a universal single-payer system. And there's no other president before that would have given us the time of day than Obama now. And that's why we have to demand, we need money spent on more important things like our national health care rather than sending our young people my age to fight in some war.
I agree with you 100%.
So I see logically
100%.
why you're saying a country like Scandinavia does not spend money on healthcare, but this is where the young people like myself have to stand up and say enough is enough. The way that the young people did in the 60s and said, I don't have to live in a racially segregated society. I don't have to live in a society that prioritizes warfare over healthcare. And that's why, if you notice, I passed out those flyers. Also, I've asked, I thank everybody for signing up on this sheet. Hope to keep in touch and really build a movement to get more priorities diverted from the U.S. military, because that is another significant difference between Scandinavia and a lot of the amount of money that is spent on military.
Well, look, if we had the money that they spent on Iraq, we would have a universal single-payer health care plan. The money that they spent on that war would support all of the social programs that we wanted. All of them, not just health care, but education and so forth too, would be supported with that money. I mean, they're spending billions of dollars every day. You know, just what they spend on bombs and food and, you know, and supplies. I mean, it's enormous, you know, the amount of money that they spend.
I believe that war supports the economy.
Well, it doesn't support our economy, it supports somebody's economy, believe me. It supports the military industrial complex.
Exactly.
It supports their economy.
A byproduct of that.
That's right. So I mean, you know, people who are making bombs, people who are making uniforms, people who are making tanks and stuff like that, they're doing well. Planes and stuff like that, that's booming with them. You know, but people who need to have a decent education or decent health care, they're suffering. And that's your point.
Yes.
That's your point.
And just to bring it in context to what Obama's trying to do in August, he's trying to really do what Nancy Pelosi did and make symbolic progress even though it's not substantive. He's trying to pass a health care bill before the August recess, because House is in session until August, the beginning of August. And I think one of the things that's going to happen, there's an over 90% chance that the plan that will be passed, according to the meeting that Dr. Robinson and I went yesterday, the National Physicians Alliance, is that there will be in the plan that Obama's trying to pass a public
health option. Right.
That means you can buy into it, but as I was saying initially, if you don't have a job or money to buy into it, what good is it?
Right. And you know what, and this is a question that I asked, because I asked him how much the plan would cost, and I didn't get any answer. You notice that nobody gave an estimate on what the cost to buy into the plan was. Nobody gave that estimate. And I said, that's a bad sign when you go into a restaurant and there's no price on the menu. That's a very bad sign.
You're going to be paying a lot. And the reason they did not put that price is because it would probably be unaffordable for people who do not, and especially who are supporting a family. Right. So the whole point why I've organized, if you are interested in organizing for single payer, that is the ultimate goal that hopes to come out of these discussions. You can email me, I'll share everybody's email to leave here. And basically what we do once you've committed is just a matter of contacting people in the U.S. Congress to let them know the importance of single payer. Right now there is a bill in the U.S. Congress sponsored by John Conyers that is described on that handout called HR 676. And there are currently 70 co-sponsors, around 70 co-sponsors in the U.S. House. We're trying to increase that number to beyond the majority of the House, which would be somewhere around 250, because there are about 400 in the U.S. House. It will have a tougher time in the U.S. Senate, which is definitely more conservative. Yes. Even though there are Democrats there, they're very moderate to right Democrats.
That's right.
So that's the whole point, to continually talk to the congresspersons I know that in terms of Philadelphia area, Shaka Fatah
Yes.
and Bob Brady, the U.S.
They're both
representative from
supporters,
it, they are supporters
Yeah.
of it. However, you know, we don't need to convince them, we don't need to call their offices. And a lot of times when you call congresspersons' offices, unless you're their constituent, they don't want to hear.
Okay, I'm outside of Philadelphia. Where does Jim Gerlach stand, do you know?
He's your U.S. representative?
Yeah.
I don't know. I would
Okay,
love
I'll
to
check.
find out,
All right.
yes. And just find out where they stand and ask them, tell them the importance of, in the long term, a single payer system. I don't know if you saw C-SPAN's wonderful interview with Obama on Sunday. He basically said the rate at which the healthcare system is going, like Dr. Robinson said, it's not going to survive.
Right.
You'll have too much people who are getting into older ages, needing coverage, and it's just going to cause a big issue. And the best way to deal with it is by saving money in the long run, which is with a single payer system.
Right. Well, you see, the issue is, and see, this is what a lot of people miss, is that the issue in terms of having an effective plan is controlling costs by, first of all, improving health and doing prevention. See, one of the problems with our system, a big problem with our system, is that when you have a fee system, or paid, fee for basic service, I mean, they say it's managed care, but it's really not managed care, it's managed costs. But it's still a fee for service, because the doctor or the medical institution, wherever they get paid for what service they do for you. And that service is for something that has an ICD code, which is for an illness. You don't get any payment or reimbursement for prevention or health promotion. Those are things are very small coverage. And even when they do cover them, they are not, token for the whole group. Now, let me give you an example of that. One of the areas that I'm an expert in fact, I've written 3 books on it, and that's smoking cessation. I'm one of the authors of the clinical guideline on smoking cessation. So as everyone knows, and here in America, smoking is the #1 cause of preventable death and illness in America. Hands down, smoking, okay? Look at all of the things that are associated with smoking. Lung cancer, heart disease, emphysema, blah, 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 asthma, blah, 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 secondhand smoke, it's a long story, okay? Now, you sign up for an HMO, okay, a managed care organization, okay? And so, of course, all of the managed care organizations have disease control programs, right? Now, say the managed care organization has 100,000 people that are signed up in the managed care program. Well, we know from looking at statistics, and just take a low number, that 20% of the people in the health plan smoke cigarettes, okay? Well, they have a course that has a capacity for a couple hundred people. So are they really serious about doing smoking cessation for their group of people when they got thousands of people and they got a few hundred slots for their health maintenance programs?
But even so, those classrooms are filled.
That's right. That's
So
right.
even though-
Well, they don't push it.
Purpose.
Right, well, I mean, you still can't get 100 people that are interested in participating.
That's right. Well, but they could if they really, whatever, they tried. They could if they tried.
Well, they're.
See, my point
We have it and
is,
nobody
but my
uses it.
point is that they have it there so they can say that they offer the benefit.
Right.
But the reality is, they don't want to offer that program because they don't,
Could I comment on that? So if you don't get enough people to come to a class, there are other ways you have to explore other ways of helping people to stop smoking. In other words, you work with them individually, you send out letters, you give them patches. But I guess you understand what I'm saying? In other words, sometimes people just don't want to come to a class and they're not class oriented, or they don't have time to go to the classes. Then to me, the organization has an obligation to say,
that's right.
this is the way we'll help you to stop smoking, or to stop eating, or to stop drinking, or whatever it is that you're doing that's destroying your body.
There you go. You're absolutely correct. But see, my point is, I take it further than that. I say that they actually don't really want to do it. Because look, they've got experts that work for all of these managed care companies. People who are trained in health promotion and chronic disease. I mean, they're paying these people, hundreds of thousands of dollars. And believe me, they have experts there. And so if that was a priority for the managed care organization to do disease and prevention and cost prevention programs, they would find effective ways to do it, just like she said.
If it were financially effective.